If the left side of the heart goes out, why does the right side start to struggle and eventually go out a lot of times? I had someone send me this message today and ask if I could explain it. So here's a little short video trying to explain it. The left side of the heart, especially left ventricle, is pumping blood out to the body systemically. And so one of the top things that's going to cause a problem and cause heart failure in patients is long-term hypertension, because the heart is having to pump so much harder when you have a high blood pressure to push blood out of the heart. So now this left side is starting to back up. So if the left ventricle is not working, then it's going to back blood up into the left atrium. And then eventually that blood is going to go to the place that it was right before, which is back toward the lungs. It's going to cause high pressure in the lungs, and that's called pulmonary hypertension. Now let's think about the heart as being two separate pumps. There's the left side that's the pump, and there's the right side that's pumped. The right side of the heart receives blood. It goes in the right atrium to the right ventricle, and then it goes to the lungs. Now, if you think about this pulmonary hypertension that's been caused, this high blood pressure that's in the lungs, because of the pulmonary hypertension, now this right atrium is not going to be able to push blood as easily. And so it's going to wear that side out. So that's how left-sided heart failure can cause right-sided heart failure. And that's why a lot of times when the left ventricle fails, this pressure builds up, and over time we start to have right-sided heart failure as well. And to add to that, if you have a patient that has an LVAD in place, now all of a sudden the left side is putting out so much more blood with the LVAD in place that the right side of the heart is now having to deal with. And so the right side is not used to having to deal with that amount of pressure coming from the left side, because the left side's been not working that great for that long. So if the right side was already weak and now there's all this extra pressure from the left side finally working, that can also be a contributing factor of a patient having to get an RVAD if the patient already had an LVAD. And of course, last honorable mention goes to this Highland Cow shirt, who is the real star of this video.